Hi, this is Brian Kim. I'm going to share with you case number 33 in the best way to do cataract surgery series. This is a medium pupil, moderate size lens, but it's more importantly, it's a sticky lens, a lens that as you begin to chop it and separate it, it tends to still be attached to the main piece of the cataract, and it's a little bit more cumbersome and annoying to do. And so I'm going to show you mechanical fracturing techniques, double chop and cross chop, and how I'm able to systematically disassemble the lens, minimize ultrasonic energy. When you're frustrated and the lens is sticky, the tendency is to use more phaco energy. And by employing mechanical fracturing techniques, these cases are just a little bit less annoying. Use a corneal marker to help me center and size my rhexis. And then I make my paracentesis incisions, making sure I'm flat to the iris plane to have a nice self-sealing incision. I'm injecting intracameral lidocaine and then intracameral epinephrine. I'm going on the surface of the iris as well as underneath the iris. I'm injecting some dispersive viscoelastic to fill the anterior chamber. And you can see I get some pretty good viscodilation, but otherwise the epinephrine didn't seem to help enlarge the pupil. Perhaps it stabilized it. I'm doing my triplanar corneal incision. I'm making a vertical groove, place the blade into the groove, tunnel through the cornea, enter the anterior chamber. Doing my puncture style capsulorhexis, puncturing with the forceps, pulling downward, and then creating a little bit of a flap towards the right, grasping the flap, trying to use the corneal mark to help guide the size and centration of my rhexis. I'm grabbing and re-grabbing. And then I'm finishing off the rhexis, and then I'm going to burp some viscoelastic, which will help for the hydrodissection. I'm going to do my capsular fornix hydrodissection technique. Place the cannula out to the contralateral equator underneath the anterior capsule rim into the fornix. Point the tip down, get a nice fluid wave, decompress on the left side, and then spin with the right side with the tip downward. You get a nice rotation of the lens. You go with the phaco, irrigating the surface of the eye first, making sure there's no bubbles in there, lifting the incision with the chopper and going in with irrigation off to minimize Descemet's trauma, removing the surface epinuclear material, place the chopper out to the equator, place the phaco tip vertically subincisionally, crush the lens in half, and that's the double chop. Place the chopper out to the contralateral equator, pull it towards the center, and that crushes the right heminucleus in half. That's the cross chop maneuver. I use high vacuum to pull that first quadrant up very carefully, and then I'm crushing the lens piece between the chopper and the phaco tip. I'm using the chopper to crush the lens piece against the phaco tip. I'm using predominantly high vacuum and a little bit of ultrasonic energy. I'm using some vacuum to grab that second piece of that first quadrant out of the bag. You can see whenever I crush the lens between the chopper and the phaco tip, I stop the vacuum and I crush it, and then I resume the vacuum. I place the chopper out to the equator again to get around the second quadrant, and then I crushed it against the phaco tip. You can see that because it's so sticky, it doesn't want to just come out of the bag. It's still stuck to the lens material. It's still in the bag. And so I had to go after it again and crush it and chop it again. And now that the pieces are small enough, it's mobilized the lens piece out of the bag, and I'm able to use mechanical fracturing forces to crush the remainder of the lens pieces. But again, despite this not being a really, really dense lens, it's just very sticky, so it just makes it much more cumbersome to disassemble this lens. I rotate the second heminucleus in front of me, place the chopper out to the equator, place the phaco tip deep in the bag. You can see I was able to crush and divide that second heminucleus into the third and fourth quadrant. I place the chopper out to the equator and I crush the third quadrant, dividing it into smaller pieces, using the vacuum to help manipulate the lens pieces, and then crushing it between the chopper and the phaco tip. I'm going to turn the fourth quadrant in front of me, place the chopper around it, place the phaco tip deep, crushing it in half. But you see it still doesn't want to completely separate. Again, this is just the nature of this sticky type of lens. I'm crushing the lens with the chopper against the phaco tip. And again, I'm being careful when I'm applying that vacuum. You don't want to apply the vacuum during the crush. You want to crush it first, and then you place the chopper deep, and then you activate the vacuum, and you do it this way to protect the posterior capsule. Now all the endonucleus is essentially removed. Take the chopper out, and I'm pushing BSS through the cannula, take the phaco tip out, and then replace it with the INA handpiece. Starting subincisionally, remove the cortical material. I have the polymer tip, which gives me a lot of confidence. I'm able to use foot pedal control to control the amount of vacuum. You want to get up to the tip and just slow rise in the vacuum, and then you start pulling the pieces out with the vacuum. You can see this is a fairly clean bag now, and I switch to the polish mode to get underneath the anterior capsule edge to remove any cortical material, lens epithelial cells. Again, I do this when there's a smaller size pupil. I'm now removing the lens material from the posterior capsular surface. You can see the polymer tip was able to sweep off and remove that material very easily with that polish mode in place. You saw that it grabbed a big chunk of subincisional cortical material. There's a piece right at the incision, so I crushed it. I'm using the BSS cannula to flush the subincisional capsular fornix. It's fairly clean, I don't see anything there. And then I'm pushing some cohesive viscoelastic to inflate the capsular bag. And then I'm using the sweep to polish the anterior capsular surface, first sweeping on the left side and then on the right side. I try to limit how aggressive I am with the sweep when the pupil is smaller in a situation like this. I'm injecting my single piece acrylic intraocular lens into the capsular bag. Make sure the leading haptic's in the bag. And then I go in with the INA. By inflating the eye, I'm able to ensure that the entire lens goes in the bag. I separate each of the haptics, get underneath the optic, rotating it 90 degrees clockwise, tilting it to make sure that both haptics are in the bag, evacuating the viscoelastic from within the bag, repositing the lens into the bag, removing the viscoelastic in the anterior chamber now. You want to make sure you get into the angles, remove any viscoelastic that might be hiding there. I want to use some BSS to pulse the angle to make sure there's no viscoelastic hiding from me. I take the INA handpiece out and then take the BSS cannula out and then hydrate my incision. So you can see this is using double chop, cross chop, mechanical fracturing, disassembling a fairly moderate sized lens, but more importantly, a very sticky lens. These lenses, even though you break them apart, they still like to stay together. And so when you get frustrated, you might try to use high ultrasonic energy, and it's really not necessary. You can just use mechanical fracturing forces, using the chopper, teasing the pieces apart. By doing lens disassembly this way, using mechanical fracturing forces and using the chopper and the phaco tip to separate the lens pieces rather than using high ultrasonic energy, this is a much more controlled and safe, in my opinion, a better way to disassemble the sticky lens. So I hope this was helpful to you, and I thank you for your attention.